My name is Patrick McGorry. I've been working in Australian mental health care for nearly 40 years, and I'm really concerned about the effect that this COVID-19 crisis is going to have on all of us, not just people with obvious mental illness. It's a major threat to our mental health, and you can just imagine what those sources of threat actually are. Losing our normal sense of security, having to confront the fear of the virus, losing a lot of other things in our lives, the ability to exercise, to mix with other people, to have a social role, to have a professional role or a work role. These are really big challenges we're all facing. On the other hand, we've come through these crises many times before, and people are generally very resilient, but they do need the right sort of support and the right sort of professional help when facing these sorts of times. That sort of help is available in Australia, and we are working with the government, state and federal, to actually make sure that we have the best chance of supporting people who develop mental health challenges or crises during this period. One of the things we can all do in a crisis like this is something very simple. Just be observant. Look around you at the people in your life, or people even strangers you come across during the crisis. And if they're struggling, if they seem to be distressed, if they seem to be struggling from a mental health point of view, or if they just need help and need support and understanding, try to reach into your reserves and be as tolerant and kind as you can, listen carefully, and try to help them in a practical and an emotional way as best you can. This is called mental health first aid, or there are lots of other terms for it, but it's actually just common sense and basic humanity. And we can all do that, even if we're feeling stressed. And we can all receive that sort of help too, be open to receiving that sort of help. It's something simple. The other thing we can do is, if we really are concerned about people from a mental health point of view, we can actually help to connect them with services, whether digital, online, or in face-to-face sort of settings. That expertise is there. We're reorganizing how it's delivered. We will have to work very differently. We'll have to work around the virus, but I think we can do it. And with your support, and with the support of all the people working and dedicated people in the mental health sector around this country, I think we will come through it. It will take time, and we'll have to keep it going for a fair while. But we have stamina and we have expertise, and we will do our very best to make that available to every Australian.